Hello and welcome to the YNOT Health project. In this video, we will be talking about abortions to dispel common myths surrounding abortions and giving more information about the legality of abortions in Southeast Asian countries. The purpose of this video is to simply inform those interested in learning more about abortions and contraception. We, the YNOT Health team, hope that you can make informed decisions based on the impartial view we have provided on this topic. Please always consult a medical professional when making your decisions regarding your health and do what feels safest and most comfortable to you. Now, let's get into the topic. What exactly is an abortion? An abortion is defined as the removal of pregnancy tissue, products of conception, or the fetus and placenta from the uterus. However, depending on the time of the abortion, the definitions and processes of the abortion will change. There are 5 main stages at which an abortion can take place. This procedure involves taking methotrexate and misoprostol drugs that will stop the cells in the embryo from multiplying and growing. This is called a medical abortion and can be used until the 10th week of pregnancy. The procedure involved taking 2 medications in pill form. First, mifepristol, which will block the hormone progesterone and prevent the embryo from implanting in the uterus and growing. Then, misoprostol is used to push out the pregnancy tissue. This can cause heavy bleeding and cramps. Another procedure takes place early in the second trimester until the 16th week of pregnancy and is called vacuum or suction aspiration. The surgical procedure involves gently pulling the fetus and placenta out of the uterus. After 14th weeks, dilations and evacuations can be used. This procedure is surgical and generally used in the second trimester by those who delayed getting an abortion or must end the pregnancy due to a severe abnormality or medical problem with the fetus. Dilations and evacuation is a combination of vacuum aspiration, forceps, and dilation of the cervix, a minor surgical procedure. Finally, is the induction abortion, which is usually performed when dilations and evacuation can no longer be done. A medicine is taken that induces labor while a surgeon cleans out the uterus. Because abortions may not be talked about as much within certain cultures and communities, there are quite a few stigma and myths surrounding it. One of the most common myths is that abortions are dangerous. This is false. When abortions are performed by qualified practitioners, they are remarkably safe. In reality, abortions are actually 14 times safer than a childbirth. In a study done by Dr. Zane for the CDC, it was found that abortions have a mortality rate of 0.7 for every 100,000 procedures. A second myth is that abortion can cause infertility and cancer. According to the American College of Obstetricians and Gynecologists, there is actually no link between abortions and complications with future pregnancies. There has also been no reported link between abortions and breast cancer. Another common myth is that abortions can cause damage to your mental health. While unplanned pregnancy can cause emotional distress, the abortion itself won't cause any long-term psychological distress. However, it is important to note that women who feel coerced into having an abortion, women who hold strong religious or cultural views against abortions, or are diagnosed with mental health conditions could experience longer-lasting emotional distress. Lastly, it is still a stigma that women who get abortions are young people or are irresponsible. Women of all ages in their fertile years, race, income level, and education have decided to have abortions throughout the years for many different and similar reasons. There are numbers of reasons a woman could choose an abortion, including sexual assault, being financially or mentally unprepared, or having an abusive partner. It is important for us to realize that having an abortion is not an easy decision and do need a lot of consideration. Finally, how often do abortions take place and where are abortions legal in Southeast Asia? On average, from 2015 to 2019, there were 73.3 million safe and unsafe abortions globally. Among these, around one-third were carried out unsafely. Over half of unsafe abortions take place in Asia, specifically South and Central Asia. Abortions are completely legal in Singapore, Cambodia, and Vietnam. In Thailand, abortions are largely legal. They can be performed to preserve mental health and physical health in the case of rape, fetal impairment, and to save the woman's life. However, they are not always legal on request. In Indonesia, abortions are fairly illegal. They are only legal in the case of rape or incest, fetal impairment, or to save a woman's life. Abortions are also fairly illegal in Malaysia and Laos. They are only legal to preserve mental health or physical health to save the mom's life. Finally, abortions are illegal in Brunei, Myanmar, the Philippines, and Timor-Leste, except in the case of saving the mom's life. Thank you for watching. We hope that you find this video useful and informative. Always remember, an abortion is an individual choice. If you have more questions about abortions in your country, please make sure to seek for help from a trusted medical professional.